All right, we're back with round number 2. We also forgot that we shot the knee assessment on the camera as well. So we're gonna demo this for you real quick so you have it to practice for tomorrow. So in this setting, Josh is already on the ground here. This is the affected knee. We've already done our Thessalys test, which remember, I'll demonstrate for you real quick. You wanna have flexion of that affected knee. Stabilize them just like this and have them turn side to side. That's assessing for meniscal tears, which are really common in sports. So now that we're on the ground here, if this is the affected knee, the first thing we're going to go to is a Lockman's test, right? So this is assessment of the ACL. The ACL is designed to resist anterior translation of the tibia. So this leg bone coming too far forward, that ACL stops that from happening. So with all sports medicine assessments, right, we take what the thing is designed to do and we ask it to do its job. And if it can't, that's a positive finding for the test. So the way we do that for an ACL is we stabilize the femur here, other hand back around the calf, kind of in the groove here, and we're gonna pull forward, right? And we're looking if that elicits a pain response, or if this bone excessively translates anteriorly. How do we know that? We've already assessed this if we're really, the other extremity, if we're really worried about that, right? So from here, we don't have to move. We can assess the PCL, right? So the PCL is designed to resist the other movement. So posterior translation of the tibia. So stabilize the femur again. I've got this foot kind of trapped here, and I'm gonna push this tibia posteriorly. Again, looking for that to elicit a pain response and looking for excessive translation posteriorly of the tibia. Does it move too far backwards, right? From here, I bring this straight down and get him to relax, right? I'm gonna test the lateral collateral ligament. So from here to here, okay? With what's called a varus stress test. So I'm gonna press medially to laterally on the side of the knee here while I stabilize this ankle, just like this. And I'm looking for that thing to move more than it should, and does that elicit a pain response right here? Same thing other side for the MCL. I just switch sides, just like this. The pressure is lateral to medial this time. Same exact thing, just in reverse. Does that elicit a pain response on the medial aspect? And does that move more than it should compared to the unaffected extremity? Finally, your patellar tendon, right? Which comes from the quad over the patella and inserts on the top of the tibia. So we're gonna go down here. First, I'm gonna visualize this. Is this patella where it shouldn't be? Is it up here or out here, right? Second thing I'm gonna do is check for hypermobility. This won't work at all if they're tensed up. So just have them relax as much as they can and shift that thing side to side. It should move. It shouldn't move down here, okay? And you can also palpate here. So I'm gonna palpate above the patella, ask them if they feel any pain, palpate below the patella, ask them if they feel any pain. And finally, what I'm gonna do is I'm gonna stabilize this knee for them, just like this. And then I'm gonna ask them to extend that leg, okay? One of the points of the patellar tendon is to create that movement, all right? So if they can extend that leg with no pain, patellar tendon is probably intact. And that's your comprehensive knee exam. Okay?